Today topic is the radiological signs of the Perthes disease. Perthes disease in normally we seen changes in the hip, acetabulum, epiphysis, physis, metaphysis, and articular cartilage. Firstly, in the epiphysis, there is a sclerosis of the epiphysis, and there is a loss of the epiphysis, also known as the collapse of the epiphysis, and there is a fragmentation of the fragmentation changes occurs, and there is a sometimes there is a subchondral fractures, also known as the Keffi's sign or crescent sign, and there is a lateral subluxation of the epiphysis or extrusion of the epiphysis. In physis, there is a premature physis is widened, and there is a irregularity of the physis and premature closure of the physis. In metaphysis, the neck is widened and shortened, known as the coxa breva and coxa magna, and there is a metaphyseal cyst. Metaphyseal cysts are the two types. These are the true cyst and the false cyst. True cyst is filled with the fluid, and false cyst is it is a content is the physeal cartilage, so it is the extension of the physeal cartilage into the metaphysis. um, Sometimes physeal changes are superimposed on the metaphysis and metaphyseal irregularity. Next, come to the medial. First early sign is the medial joint space is enlarged. This is known as the Waldenstrom sign, and acetabulum is widened, and bicompartalization of the acetabulum, and there is a premature closure of the triradiate cartilage. And there is a gaze sign. Gaze sign is V-shaped lucent defect in superior part of the epiphysis and or adjacent metaphysis. This sign was first described by the Courtney H. Courtney Gaze, a British. He is a British radiologist. And then another sign is the sagging rope sign. Sagging rope sign is the proposed by the Apley and Winthrop in 1981. This is the sclerosed anterolateral edge of the deformed enlarged femoral head, and there is a elevated trochanter or overgrowth of the trochanter is seen. Based on the subchondral fracture, there is a Salter and Thompson proposed a classification. This is the group A and group B. Group A is the less than half of the head is involved. This is the good prognosis. Group B is the more than half of the head is involved. This is the bad prognosis. And next, coming to the cateral classification. Cateral is classified based on the AP and lateral views of the hip, and plus or with or without arthrogram changes. He applied during the fragmentation stage. He divided into the four groups. First group is the antero part of the epiphysis is involved, no collapse, no metaphyseal changes, and the cause of the disease is the absorption of the involved segment followed by the degeneration, and second part is the anterior part of the epiphysis is involved with collapse, but height is maintained due to the medial and the lateral pillars, and metaphyseal changes are not no metaphyseal changes, and type 3 is the entire femoral epiphysis involved except a small portion of the posterior epiphysis, and the remaining part is sequestered, and there is a scene is the head in head appearance in AP radiograph, and collapse is present. Extensive metaphyseal changes is present in group 3 and group 4 with wide and broad neck. In group 4, whole epiphysis completely sequestered and collapsed. Early loss of the height between the growth plate and the acetabulum roof indicates the head flattening. With the displacement of the epiphyseal fragments anteriorly and posteriorly, it produces the mushroom-like appearance of the head. There is no posterior viable portion on lateral radiograph. Metaphyseal changes are also extensive. Next, headings headings classified this during the fragmentation stage. Group A, B, 3 heading divide 3 pillars: central pillar, lateral pillar, and medial pillar. Heading classification based on the lateral pillar. We don't consider the medial and the central pillars. In Group A, no involvement of the lateral pillar. The full height is maintained. In Group B, more than 50% of the lateral pillar height is maintained. In C, less than 50% of the pillar height is remained. Heading modified his classification modification. In this modification, B/C, in this loss of the loss of the height at about 50%. Next, coming to the other investigations, bone scan. Bone scan can confirm the suspected case of the leg calvi Perthes disease. There is a decreased uptake on the bone scan. There is a cold lesion and provide information on extent of the femoral head involvement. Next, come to the dynamic arthrogram. It is performed intraoperatively, can demonstrate the coverage and containment of the femoral head, and it also shows also identify the femoral acetabular impingement. Next comes to the MRI. MRI shows early involvement of the growth cartilage. If there is a early involvement of the growth cartilage, it involves the bad prognosis, and there is a horizontalization of the acetabulum, labrum, and metaphyseal cyst, and there is a increased medial articular cartilage thickness. Thank you.